Kick things off. Good afternoon. I'm Sarah Basehart, the Executive Director of Independence Now. We're the Center for Independent Living that serves people in Prince George's and Montgomery counties. I always wish that I had one of those jobs that was easy to explain, right? So you meet somebody and they say, "What do you do for a living?" And you're like, I'm always sort of a deer in the headlights, like, oh my goodness, what am I going to say? Because it's hard to explain what SILs do. So that's why you're here. One of the reasons you're here is that we get to do great things like this to bring information to the disability community. So I always try to remind people that you can get direct services from Centers for Independent Living, like peer mentoring and independent living skills training, but we're also a movement of people with disabilities who advocate for civil rights. And today, this is the Independence Amplified Maryland. We call it IAM for short. It's a series that the SILs in Maryland are hosting. It's a live stream. We've all gotten used to those in the past few months, and we feature speakers on current issues that are of the most importance to the disability community and our supporters. So just a couple technical things, and then I'll turn it over to Dave, who's hosting our speaker today. And that is that, you should, we ask you to rename yourself. If you come in on a phone number, we can't tell your name, and therefore it's hard for us to be able to call on you or get your questions. So if you bring the mouse or cursor to your box, your picture box on the right hand corner, there's 3 little dots, and you can click that and hit rename so that you can put your name in there so we can make sure we get you. You also might not want your phone number on there. Although, as I always remind people, it's a way to make new friends, but you may not want your phone number on there. This is recorded, and we do eventually post it to YouTube once they get the captions on for us. So we just want you to think about that when you have your phone number on there. And then you can ask questions in the chat box throughout today's session. Dave will be monitoring that, and Heather, they'll be sure we get your questions answered either out loud or in the chat box. Sometimes Heather is very good at typing information and making sure you get what you need. So I'm going to turn it over to Dave Dresser from Freedom Center.
Thank you, Sarah. Good morning. No, it's not morning anymore. It really is Monday today. Good afternoon, everyone. I'm Dave Dresner. I'm the Executive Director for the Freedom Center. We're the Center for Independent Living that serves Frederick and Carroll counties. And I want to welcome everybody. I'm going to do my best to monitor the chat. Hopefully other people will help me out with that. Today we have a really special guest, Stevanne Ellis, who is the State Ombudsman. I am not going to do a lot of preamble about what the State Ombudsman does because she's here and she's going to talk to us. But I think now more than ever in this pandemic, where people in long-term care facilities and nursing facilities are, if I can use the word trapped, I'm going to use that word. And it's very difficult to get any communication in or out or find out what's happening now more than ever. I think the Ombudsman program across the state is critical and crucial. And a program that certainly we as Centers for Independent Living want to work as closely with as possible. So I'm really excited for today's program. Stevanne is a wealth of information, and I'm going to, without any further ado, turn it over to Stevanne Ellis.
Well, Dave, thank you very much. I am honored to be with everybody today, and my goodness, what a lovely turnout on a Monday afternoon. So you've all definitely brightened my day, because we were talking before the call how Mondays are really hard. So I think this is a nice way to spend the afternoon with all of you for a little less than an hour. The Ombudsman program is an advocacy program for people in nursing homes and assisted living facilities. In some states, the Ombudsman program actually serves people in the community that have Medicaid waiver services for caregivers and other things, but we in Maryland go to assisted livings and nursing homes under normal circumstances and advocate for people in those settings. Also in other states, they are sometimes involved with folks that have mental health services and programs as well. But in Maryland, assisted living and nursing homes are the 2 settings that we advocate for people in. I'm not sure how many of you are aware of the Ombudsman program, so I'm going to sort of give a broad overview talk about how the program normally operates when we're not in a pandemic, talk about what we've been doing since the pandemic, and then some other information. Please, please, if you have questions, Dave is the best moderator ever. He will make sure he keeps me on task and helps me answer questions. If you stop me, which by the way, feel free to do, if I don't know the answer to something, I can get back in touch with you maybe even after the meeting, send you information. I don't know if you're feeling this way. I'm kind of overloaded with information. There's so much that's coming out all the time. So if you ask me a question, I can always get information back to you all that can be disseminated, if that would be helpful. Because I don't want to just tell you that, oh yes, it's currently this way. Like for instance, there was some data that changed about testing today. So if anybody has testing questions, I actually would prefer to send a transmittal out. So things like that, I'd be happy to do that. In Maryland, the way we're structured, there is a state ombudsman office in Baltimore. That's normally where I am. But as you can see from my background, I'm in my living room. I'm working at home, like many of you are. And for the undetermined period of time in the future, I'll be working at home, going to the office every now and then. We've been teleworking since March. And in some of our counties, the ombudsmen actually are in the office now a few days a week. Some are in the office full time. Some are all teleworking. So it kind of depends on the county. We have 19 local ombudsman offices across the state. So every county has at least one paid ombudsman. On the Eastern Shore, we have 3 offices. 2 of them cover multiple counties, and Queen Anne's County has their own ombudsman. In some counties, including there actually is an ombudsman volunteer on the call. I won't point her out, so I won't, because I didn't ask ahead of time if I could, but there is at least one other ombudsman on the call, and she's a volunteer, and she's wonderful, by the way. So we are very blessed to have volunteer ombudsmen and paid staff. We have over 40 paid staff, and we have probably somewhere between 80 to 100-ish active volunteers. And I'm being kind of vague right now because some of our volunteers are sort of taking a hiatus right now. So some are doing work, some aren't, and I think you can understand why. We're in the middle of a pandemic, so things are very different right now than they were before. So under normal circumstances, what do? We typically visit facilities on a regular basis, and for nursing homes, we try to visit them once a month. In assisted livings, if we can visit all of them, that's once a month, but in the larger jurisdictions, the goal is quarterly. And if for some reason we don't make that goal, and I'll just say Baltimore City, for instance, has 400 plus assisted livings, they typically triage, which facility needs a visit more than others, and that's kind of how they do it. For the most part, we try to get to every facility a minimum of quarterly. And that's just to see what life is like in the facility. What kind of services do they have? Do the residents seem happy? What kind of staffing do they have? We like to go during mealtime and during activities to see what life is like, because no matter how long you're in a facility, it's your home for an undetermined period of time, whether you're there for rehab or you're there for a longer duration. We really want to know what life is like in those facilities. And our role is to advocate for people. So do they understand what nursing homes and assisted livings offer? Do they have concerns? Do they have questions? And if they do, then the other big part of our job is to make sure that they get answers to those questions. And if they have a concern, we try to resolve it to their satisfaction. So that's something that's very different for us than for Office of Healthcare Quality that licenses the facilities. They look at things from a minimum standard. So how often should you have meals? What's the time frame? What should they be offering you nutritionally? We're interested in what exactly would you like to eat, and are you getting it? And is the food prepared the way you want? By the way, I love to eat, so if I lived in a facility, I'm sure this is what I would want. I'd want to have things prepared a certain way. And if Dave were my ombudsman, I would be talking to him and say, Dave, food lately has been great. Or the next time he came to visit, I'd say, I really would like to have the fish or the salad or whatever prepared a certain way. Can you help me with that? And if Dave were my ombudsman, he would say, yes, I will talk to the staff, or we can meet with them together. And that's typically what we would do in normal circumstances. Now, as we know, beginning in March, something awful happened. The virus really started giving us a lot of problems in Maryland, as it did across the country. And the pandemic, we didn't realize how bad it was then. And I can tell you, I don't know about you all, I didn't expect it to last as long as it has now. But that's when things really changed for us. We stopped going into facilities back around St. Patrick's Day. And for many of you that do this work, I'm assuming, and maybe if I can see some of you, for those of you that go into facilities, is that about when you stop too? If people can say, shake your head yes, or anyway, so that's about when, for those of you that go into facilities on a regular basis, that's probably about the time you stopped going into. So we stopped going in March. And so what have we been doing since that time? We've been doing a lot of phone calls. Instead of doing visits, we're doing calls. And the way we're doing that is one of the lovely things about our authority under the Older Americans Act, we're allowed to get a list of residents. So we got a list of residents, we got a list of their contact information. If the residents aren't their own decision makers and can't talk to us, and that's key, by the way, we really want to take direction from the resident. We don't want to just call the daughter, unless we really need to call the daughter. No offense to kids, but it's about the resident. What does the resident want? So if the resident could give us direction, we really want to talk to the resident and find out how they're doing. So the ombudsman and myself as well, we have been calling residents since the pandemic started instead of doing visits. And we've been talking to them about the sorts of things we always talk to them. How are you doing? How are you feeling? You know, how is the food? How are you spending your day? And we're finding that these conversations have changed for some people over time. Some people really, things are pretty much the same as they always have been. If they didn't leave the room very much, life's not too different for some of those folks. But other folks that like to go out and about, like to have communal meals, like to sit outside, the world has been very different. And as Dave alluded to, a lot of people have really been closed in their rooms. And that's pretty tragic for them, I think, for good reason, right? Because the facilities are trying to protect residents during the pandemic. They don't want the infection to spread. They don't even want it to get in the building. But once it does, they really want to protect residents. And I think that you all would agree that that's very important. But we are noticing there's a balance between infection control and rights. And we've seen from the beginning that sometimes these are at odds with each other. So a lot of our conversations have been about helping the residents and family members understand what's happening in facilities and how does that affect them and how do they work through it. And I can tell you, I'm very grateful to my staff and the volunteers for doing those calls, because those calls aren't easy. I mean, I'm sure if you've been talking to people in facilities, you're finding the same things, that the calls aren't always easy. People are really, some of them are doing just great, but others are really struggling with this. And so a lot of the work we've been doing is listening to people and talking to them and helping them find solutions when we can. So we really have spent a lot of time on that. And again, I'm very grateful to my staff. We've spent a lot of time talking to facility staff, and a lot of them are doing a fantastic job. They are, I think a lot of them are doing the best they can with the pandemic. They have to digest a voluminous amount of information. They have to be able to implement it. They have to be able to make sure their staff are aware of what's happening. And then they have a lot of communication obligations to the residents and the families. And so a lot of what we've been doing is making sure that the facilities understand the guidance that's coming out, that they have the guidance that's coming out, that they know where to look for it. And some of that guidance is from the Centers for Disease Control, so the CDC, the Maryland Health Department, Office of Healthcare Quality, Centers for Medicare and Medicaid Services, especially for nursing homes. We really want the providers to know how to find everything. And so early on, a lot of the work we were doing was helping people get that information, showing it where it was, sending it to them if needed. And by the way, we weren't alone in this. For those of you that are on the line, I saw some familiar county friends, colleagues. A lot of your staff have been sharing that information as well, and probably some of you that work for other agencies, making sure that the facilities know how to find information, where it lives, reputable, vettable information, and also the fact that it changes all the time. So how do you keep current with all of the information that's changing sometimes multiple times during the week? We've had weeks where it's changed just about every day. Something new has come out. So I pat the facilities on the back that are keeping up with all of this, in addition to the patient and the resident care they're giving. I mean, that's really hard for them. I don't know if I saw some questions come through the chat. I don't know if this is a good point to answer any of them, or if you want me to keep going, Dave. What would you?
We can, there's a few in there. I think there's some good, if you want me to read them to you, That might be easier.
Yeah, that way everybody can hear them.
That's a good idea. So the first question was, do facilities know that you are coming?
So so right now, we are really not doing visits. We can, just an aside for our current status, we can in some cases do outdoor visits right now, and those would be scheduled. And there's a lot of information and guidance about that. So if you have questions about when a facility can allow outdoor visits or window visits, please, at the very first of the chat box at the top, my contact information is there. Feel free to email me or call me, and I'd be happy to send you the latest and greatest guidance that's out there, including the visits. So for right now, yes, we would, if we want to do an outdoor visit, we would schedule that just like a family member would. That's what's required in the current state that we're in. Prior to the pandemic, we sometimes would go unannounced, and sometimes it would be scheduled. So for instance, if we had a family meeting, probably like for some of you that have family and resident meetings, those are typically scheduled. And lots of people are involved, an interdisciplinary team, other people, case managers, peers, etc. We would let them know that we're coming. So that's the question. But many times it was unannounced because maybe we were going out because we had a complaint and we didn't want the staff to know ahead of time that we were coming. And just to keep in mind, just to emphasize, our role is to resolve things to your satisfaction if you're the resident. So we're not doing an inspection like the regulators are. We're looking to see, is Dave happy with his food? Not did it meet the regulation or the requirement of law. We're sort of like the icing on the cake. And that's kind of what we do. So that's a really good question. Thank you.
Okay, a couple more before we move on.
Sure.
We'll do them now. And some of them are multi-part. So the next one would be, how often do you visit? Do volunteers make the visits also, or is it just the actual paid ombudsman? And while you're there, are you asking if they'd prefer to live in the community? And do you guys refer to Centers for Independent Living?
So
a lot of questions in that one question.
Yeah, so if I miss something, tell me. So we do visit, it depends on the facilities, but we try to get out there on a regular basis. So if we don't have a complaint, once a month is a great goal. For assisted living, it could be quarterly. Other facilities, it may be more often or less, depending on what it is. We talk with residents about all sorts of things. So often we have talked about if it comes up, or if it's something that we're concerned about discharge planning. We have talked about discharge. We have talked about going back out in the community. We've helped people with that. We have told people about the CILs, the Centers for Independent Living. In fact, many of us have worked with case managers, supports planners, peers. I've worked with the Sunshine folk for years, as an example. So yeah, so yes, the answer is yes. And also anybody can make a referral to us. So if any of you are working with someone in a nursing home or assisted living, or you know of someone, you're welcome to get in touch with us and to talk with us about anything at all, concerns, questions about the facility itself, anything else. And I think I missed something, Dave. Did I miss something, or did I get it all the questions?
No, I think you got all that. And
volunteers.
Volunteers are going in as well as the paid ombudsman.
Yeah, an ombudsman is an ombudsman is an ombudsman. So if you
whether they're paid or volunteer.
Exactly. If you've gone through all the training, you're an ombudsman. Gotcha. And it's a very rigorous training program. By the way, we're always looking for new people, both employees. We have some actually employment vacancies. So if you know anybody who wants to work in Charles or St. Mary's, send them to me. But we also are always looking for good volunteers, and be happy to speak with anybody about what it means to be an ombudsman. On the website that I put up there, it has information about our program, including how to contact us and how to become an ombudsman too.
Excellent. There's another question in here, and it's related to, and of course my computer's being weird, but it's related to how you would contact your ombudsman or knowing who they are. And the question is, does each resident in the nursing facility, do they get an infographic or information that lets them know who the name of their particular ombudsman may be, and the state or local areas, so that they can call directly with their concerns?
So it depends on the county, to be honest with you, and the facility. So a lot of the residents and facilities know who the ombudsman is. They're told by the social worker, or if it's a little assisted living, the staff. And other buildings, they're given that upon admission. In some places, the ombudsman has been going in for such a long time, he or she knows everybody. And so when there's a new resident, they make an effort to meet the new resident. In larger counties where staff have turned over, and I know you all know that's a big problem in some facilities, the staff turnover. So the staff may not know about our program. And so that can make it a little harder for the residents to know. The nursing homes and assisted livings are supposed to tell people about our program and give them information. But a big part of our job is to let people know that we exist, what we do, how to access our services. And so usually through a combination of all those things, that's how we get the word out. And then also I tell you, part of the reason I like to do meetings like this is because I want you to tell people about our program and what we do and how we can help. And we want to help you too, but we also want you to spread, I'm just being honest, we want you to spread the word about our program too. The more people that, it's like about the Centers for Independent Living, the more people that know what you do, the better it is. The same thing for us. That's
Excellent.
a great question. Great question.
Can we do one more before you move on?
Of course.
Okay. Actually, I have two more. The first is there anything that's out of the question for the residents to ask for when you're talking with them?
Well, let's see. Well, if the person wanted to be more specific and brave and ask me what that might be, I could probably better answer it. But no, I think they can ask for anything that they want because it's their home. So I'll give you some examples maybe that might help the requester. I've talked to people about alcohol. I've talked to people about smoking. I've talked to people about illegal things. By the way, it's hard. We can't advocate for things that are against the law. We tell
That
people,
would make sense.
we're like, by the way, right now smoking pot in facilities is something you're not supposed to do. If the law changes, that's a different thing. But we've actually had that question a lot lately with medical marijuana and that sort of thing. But pretty much the sky is the limit. And if somebody asks something that it's not within our domain to advocate for, we're very forthright about that and say, that's really not our role. Like for instance, if they want legal help, we're not attorneys, so we'd help them find an attorney. If they want things that the facility can't provide, like they want lobster for every meal, obviously that'd be very hard for us to advocate for. That's probably not going to happen. We've had people that want care, somebody to be with them one-on-one, and that doesn't usually happen in facilities. So a lot of what we do, we're sort of myth dispellers. So, what is the facility really able to do? What are they required to do? What's the minimum standard? What would you like them to do? And those kind of things. So I would say there's no dumb questions. And if people want to ask, that's great. You're welcome to get in touch with me to see if it's something. But if it's something that we can't help with and somebody else can, then we would be happy to find a resource for that person. And by the way, whoever asked that question, if I didn't get it what you meant, ask again, or you can contact me offline if you have a specific thing in mind. Remember, everybody's different. And one of the things that we do in training, it's not about what I think as an ombudsman, it's about what does the resident want, which may not coincide with my beliefs at all. It doesn't matter what I think. It's what Dave thinks. He's the resident. And if he's asking for something that I don't like, it doesn't matter. He would never know. And I'll give you a really concrete example. I am not a smoker. I'm not a fan of smoking, but I'm a great smoking advocate. You would never know that I don't like cigarettes. And I can advocate for people's right to smoke till the cows come home. I'm really good at it. It's one of the things I've learned how to do, even though I actually don't like it at all. So a lot of ombudsmen, we've learned a long time ago that it's about what the resident wants, even if it's not in their best interest. You've heard this a lot, people's best interest, or if it's something I don't like or believe in. I can advocate for it if that's what the resident wants. And that's what we do as ombudsman. It's about what do you want?
Excellent, thank you.
Yeah.
I know you want to go on, but there's one more.
Okay, one more.
Okay. Has there been any federal guidelines put out that a person cannot be in their room 24/7? Isolation for people with disabilities is a major concern.
So I have not, in fact, so I'll just put it this way. The guidance talks about it's more restrictive if there's an outbreak in the building. So that makes sense, right? So if an outbreak in Maryland is defined as one staff member or one resident with the virus, an active case of the virus, whether it's symptomatic or not. So if you get tested and you have COVID-19, that's an outbreak if you're a staff member or a resident. And the facilities typically are more restrictive when they have an outbreak. And the idea behind it really is to protect the residents. However, having people stay in their room is really, can be very traumatic, as the author of the question asked. So the idea is to not, for people to, if they want to go out of the room, there's parameters around it. And it all depends on what's happening in the building at the time. And if you haven't seen it, I'm happy to send it to you. There's phases in nursing homes and assisted livings. And once a facility has not had an outbreak in a certain amount of time, you can enter phase one. You typically, the best way to think about it is the facility contacts the local health department, says we have adequate staff, we don't have anybody with the virus right now. Our local hospital is taking admissions, because that's actually an issue. If the local hospital can take admissions right now, because in areas that are really stressed, that's actually a big problem. And I think we understand why that is, having watched the news and experienced what we have here in Maryland. So if the building is able to move into phase one, then that's when people typically are starting to leave their rooms more often, other than just to go to do a task. So to go outside, or to go and be in a communal activity. And there's very specific descriptions in each of the phases of what residents are able to do. But there's always negotiation, right? So even if there are parameters and the resident isn't happy, we would still do our best to advocate for what that resident wants, and maybe help them understand if what they want isn't really able to happen right now. And this actually will lead me into my topic of social isolation too. And by the way, for anybody that's on the call, if there's something else you want me to go back to, I'm happy to do that. But we're very worried too. And Dave and Katie and Sarah and others have actually been meeting, I don't know, since April, I think, for quite a while now, about talking about this social isolation in facilities, and how the longer we're in this pandemic, the worse it's getting for the residents. And honestly, I think it's really hard for the staff too. I mean, can you imagine you're working in a facility and you're having to tell people, no, you can't go eat with your friend in the dining room right now. Or you're having to do the calls with the family members that are very upset because they can't physically be inside to be with their loved one. So I want to make a pretty strong argument. This is very hard on the staff too. And I really feel bad for them. And in fact, there's a lot of support out there for staff, probably for the first time ever. There's a training program through the Behavioral Health Administration and MEMS about giving frontline staff mental health services and things like that. And that's available to nursing home and assisted living, also fire department, police, and other frontline staff, probably hospital staff too. So if you haven't heard about that program, I'm happy to send out information about it, because I really worry about the staff a lot too, to be honest with you. I think a lot of them are doing an amazing job, but my goodness, it's very stressful for them. I think their job is typically stressful, but especially right now with residents being isolated and family members and friends not being able to visit. But part of what I wanted to bring up is this thought of social isolation, and what can we do in our roles to help combat social isolation for people in facilities. And so a lot of what the ombudsmen are doing is, when we're talking to residents, especially now, is we're asking questions and trying to have that conversation with residents, families, staff, to ask them, how are you doing? What are you doing to spend, and specifically for the residents, what are you doing with your time during the day? Do you have enough to do? Do you need to talk to somebody? And then back to food. Are you getting what you like to eat? Because I don't know about you, if I get what I want to eat, I'm pretty happy. So, even food can help with the social isolation. If you're getting a good meal, pretty content. And that might help with some of the other things you're not getting. For those that want to be social and leave the room, when can they get out of their room safely and interact with others safely? Wearing masks is required in facilities right now, even for residents. We don't have time to talk about folks with dementia, but specifically, because we could talk about that for a long period of time, but facilities are obligated to do special things for folks with dementia and other people that cannot wear a mask, because I don't know if you know of anybody, for some people wearing a mask is not an option. They can't do it. So what do you do to protect that resident? And what do you do to protect others from the resident if you're worried that that resident might spread the virus if they sneeze or if they breathe through the droplets through the air? So that's something that facilities are doing. You don't want to keep somebody in their room just because they can't wear a mask, but what do you do for that person, especially if it's somebody with dementia that wanders and there's no way they're going to keep that mask on their face as they walk throughout the dementia unit. So that's something that facilities are looking at right now, and there's a lot of guidance out there about that, how to help people with dementia that could be at risk to catch COVID and could be at risk to spread it. Just an aside, in case you didn't know, the facilities, they're required, and I don't like this word, but it is the word that they use, cohort, which means grouping people together. So if you have a positive test for COVID or you have symptoms for COVID, you're supposed to be separated from everybody else that doesn't have COVID. So folks that don't have the virus are in one part of the building. Folks that do are suspected to have, that need observation, are in another part. And in some places you'll see like a combination of all three. You'll see a part of the building where everybody is supposedly doesn't have the virus, no symptoms, no positive tests. There's an isolation or observation unit maybe for new people or for people that have symptoms. And then there's a unit that is for people that actively have the virus. And the idea is to keep the people separate for infection control. But just because you have the virus and just because you're in a facility doesn't mean you should be completely isolated in the sense of not having things to do during the day. So the facilities really need to take a close look at that, and many of them are. And I tell you, one of the really nice things that's happened, there's a couple of nice things that have happened during the pandemic, and I keep trying to think about this, especially the longer it goes on. It's highlighted the roles of social workers and recreation therapists and how important they are. And in assisted livings that don't have those, it also shows what a lack, that things that are missing in those settings, that they really could benefit, from my personal opinion, from recreation therapy and social work. And the need for person-centered care, having a plan for each person, not just for their medical treatment, but for the most important things other than that, the quality of life issues. How do you want to spend your time? So a lot of facilities have been very creative in how to do that for people that are in their rooms all day long. And they've done a good job. Several of us on this call are working on technology. So for the residents that have access to cell phones, tablets, or can use them, we're trying to get them that technology. And I want to thank, Sarah and Katie and Joan and Dave and Michael and a whole bunch of others that are really working hard on this, and probably many of you that, so pat yourself on the back. And we're trying to figure out ways to get technology in the buildings, making sure that they have Wi-Fi. And then for people that don't have the technology or can't operate it themselves, what can we do for them? And so we've been talking about this for a while now, because if people can reach out to their loved ones and people they care about or have internet access, it makes a big difference. And for us doing our virtual calls and visits, I've had some of the best visits through the computer, like what I'm doing with you all right now. I've been doing visits with people throughout the whole building and one-on-one meetings, and it's been great. Even for people that are difficult to communicate with, like people that are hard of hearing, if they can read the chat box, it's great. I had a whole conversation with someone with the chat. They couldn't hear me at all, but they could see what I was typing. And so it worked out really well. I typed and they answered. And we had this great conversation. He was laughing, I was laughing. We were talking about about discharge planning, very serious issues, but it was great. We had privacy because I asked him, did the staff member leave the room? He said yes. And so we had privacy, and it was really great. The one thing I want to tell you is that we're thinking about all of this right now. A lot of us, the ombudsman, people on this call, other people, we need to work together. That's the secret of getting through this. So if you have ideas of how to combat social isolation, how to combat loneliness, how to combat depression, for people that are in facilities that aren't be able to interact with other people, we want to hear from you. There are no dumb ideas. So anything at all. And that's my sort of selfish ask for the call today is what, if you have ideas, share them with us. It'll really help everybody. Our jobs are harder right now. We really miss visiting the residents and going in, and we're very worried about social isolation. For some people, there's not the solution. So for people like us that are able to communicate in one way or another, it's a lot easier for us to figure out how to deal with that. But for people that are very confused, that depended on their family members to visit all of the time, that's actually what helped with their well-being. We have big challenges with that. There are some exceptions for visitation for compassionate care visits, if you've heard about that. And initially it was talking about end of life. So if people were dying, you could have your loved one come in and be there with the person as they were dying. And that's wonderful. I don't know about you. I hope you haven't had loss, but my mother died and I was with her. And I'm very happy, not that she died, but I was happy that I had that opportunity. If I hadn't had that opportunity, I would have just been awful. It would just been awful for me. And that's actually some of the complaints early on we got is I wasn't able to be with my mom when she died. So now we're getting fewer of those kind of complaints because there's this compassionate care exception, but also they broadened it for people that need their family members there in certain circumstances. And so if you have people that really benefit and decline if they don't have their family members there, get in touch with us and we can see if it fits that definition of the compassionate care visit, because it has been expanded. And the idea is they're noticing that people are declining because of this isolation that's happening right now. And I'm happy to send you the guidance. It's not as specific as I would like it, but if you've read guidance before, that's probably a critique you have of a lot of guidance that you have for something like this. But I'm happy to share it with you. We're happy to advocate for it. And typically what we would do in a situation like that is work with the residents, their family, if that were appropriate, and the facility to see if something could be worked out. In some cases, it doesn't fit the definition, but in some cases it actually has, and we've been able to help people get family members in under certain circumstances. So I wouldn't rule that out as a possibility. The last thing I'll say, and I'll see if there are other questions at this point, most of the buildings aren't allowing in-person, in-house visits until phase 3. And at this moment, I'm not aware of any nursing homes or assisted livings that are at phase 3 yet. So for now, the only visits that are allowed in places would be outside in window visits. So I just wanted to make you aware of that. It's county by county, it's facility by facility, and God forbid the facility recovers and they don't have any COVID cases, or they never have COVID cases, but once they get one COVID case, they go back to the beginning and have to start over. And it's usually about if everything goes well, it takes about 45 days to get to a point where you could possibly have outdoor visits if you've had an outbreak. And that's also if you have enough staff and the other things we talked about. So I just wanted to let you know, for many of our facilities, it may be a long time before they have indoor visits. So this question of social isolation is really important. What can we do to help residents, families, facility staff get through this time during this pandemic and make the best of the situation that the residents are in and the facilities are in right now? And again, I think it's definitely something we should all talk about as we're working together on this. But Dave, are there other questions in the chat right now?
There are.
Lots of things.
There's a few. That was a lot.
Yeah.
I'm going back a little, but there were a couple questions that I want to make sure that you are able to hear and be able to answer.
Sure.
One is, how can volunteers help residents vote via absentee voting?
So I don't have the latest and greatest of how it's going to work right now. So I think what I can do to answer that question more specifically is once we get more information, we could share that with everybody. It is something we're very concerned about this year because it is a presidential election, and I think a very important presidential election. I think most of us would agree they're always important. So when there's more information available, we can definitely share that. Usually the Board of Election, each county has protocols, and a lot of facilities have a policy or arrangement with each of the facilities in the area, relationships with the Board of Elections. And I'm not sure, I didn't follow up on any issues with the spring to see if there were any problems with the absentee voting that happened in the spring. It's just not something I have good information about, but I'd be happy, Dave, if you can remind me, I can try to get some information about what's going to happen closer to the presidential election, and we can share that with everybody. But it is something we're going to be working on as a program too. We'll be sending information out about it and everything. It's a great question.
Thank you. Yeah, it's something that's, I think, on a lot of our lists to make sure we're revisiting. And I believe we have a future IAM presentation about voting and making sure you're registered to vote, and how that will all be working as we get a little bit closer to the actual election. There was a question, and I think I'm getting this right, and if not, hopefully the person will provide more info, but I think the question is, what kind of volunteer openings are there? So what does it take to be a volunteer? If you wanted to volunteer, how would you go about doing that? How would you find out where you could even go to volunteer, or how you could volunteer?
So you can get in touch with me. And so my information is in the chat. And if you become if you want to volunteer as an ombudsman, you would go through the whole training. We have a classroom part. We have an overall orientation. We're actually looking at how to do it differently right now because of the pandemic. I think everybody understands why that is. In addition to an orientation, we have an additional complaint investigation. We typically do a minimum number of visits with the person so that they can practice what they've learned in the classroom. We actually have a test and computerized modules. So it's a very rigorous training on purpose, though, because we do advocate for some of the most vulnerable people, and we want you to be well trained, and it is a lot of information that you're required to know. But we love volunteers, so if anybody's interested, let me know, and we're always looking for people. The only thing I'll say is that the turnaround time is going to be slower right now as far as getting people trained because of the virtual nature of things, and we're trying to figure out how to do it differently. But don't hesitate. If you're interested, get in touch with me. You can also reach out to any of the local ombudsman offices and talk with them about it. They all know how the process works. So great question.
Thank you.
Mm-hmm.
Another question is, are quarantine bubbles something that could be considered? They can often limit COVID risk and help fight loneliness.
I don't know what COVID bubbles are.
So I'm quarantine bubbles.
I don't know exactly what
I'm not sure how they would be used in a nursing facility. I know that some of the major sports programs happening, professional sports, are doing quarantine bubbles.
You mean like a physical covering that you get in?
I don't think so.
So I've looked into this for social isolation of my children, and it's like where you and another group of people are committed to, social distance and do all the right things, and you're able then to get together socially so that you're not, out there infecting a bunch of people.
Parents are taking turns taking care of children and that kind of thing.
Oh, I see. Yeah, so I was thinking of like there's actually glassed in rooms and things. I was thinking about
not a physical, but more of people that are all agreeing that they're doing what they need to do in terms of being careful.
And the way it works is right now, the way it works is that for the facilities that are allowing outdoor visits, they're limiting the visits to 2 people at a time. There's screening questions that they have to answer. If they refuse to answer, they can't visit. So it's really, it's a lot more limited. So it's actually much more extreme than what I think the questioner is asking. I think that would probably be a better question as the buildings open up more.
Right.
But right now, I think it's too early even for that. Other than the staff that are going into facilities on a regular basis, there's a few number of people that are doing outdoor visits right now. And it's usually family members and us. We're doing a few of them.
So a couple more questions. I won't say if these are from me or not, but you had talked early on about actually, because the ombudsman can't go into the facilities right now, just like we can't go in, that you're contacting residents directly via phone or through email or through a video chat service or any of those things. So I'm wondering how are you setting that up? How are you knowing which residents have phones or have that connection, or are you working specifically with each nursing facility for the facility to bring them something to connect with? How is that happening?
So
and how do we expand it?
So it depends on the relationship the ombudsman had prior. So for me, I have residents I talk to, I've known them forever. So I just pick up the phone and call them. I email them and set up times to talk to them. So some of the outreach is done directly with the resident without the staff even being involved at all, because we have their contact information before. For the other residents that we maybe didn't have the contact information or didn't know the phone numbers to the room, we get the census list and we call the residents directly. For people that don't have phones in their rooms or can't use a phone or can't navigate computer equipment, we typically set those calls up with the staff. And we've been looking at ways of making that process easier so we get more people. So what I've told my staff to do is start with people you can get on the phone, start with people that you have follow-up with, ask the staff who can actually talk on the phone and who has phones in their rooms, and then figure out then who do you have left after that and figure out what's the best way to communicate with those people. One of the ombudsmen, who I won't say who she is, she's done a lot of the virtual visits to the whole building. So she sets up a visit with somebody, usually a social worker, recreation therapist, and that staff member takes her through the whole building and has her, and she sits and she talks to the residents, so to speak, through what we're doing right now. And it's worked really well. The downside is that it's scheduled, so it can't be spontaneous, which we miss, but it's a compromise to get people involved. The downside is that it doesn't get everybody. It's dependent on staff members' availability to help. And in some places, their willingness to help. There have been some staff members that have just been like, I don't want to say amazing, but they really have been amazing. They've bent over backwards to help us talk to people. And then we've had other staff members that I'm not going to say how I feel about them. It hasn't gone as well. So we've kind of had the whole spectrum. But I'm always looking, I'd love to talk more about just this, especially as you all, as you're starting to make calls, or if you've been making calls, what have you found that works? What are the barriers? That's what I've been asking my staff. I have to tell you, I'm very blessed. The staff that I have, both the paid and the volunteers, they have been amazing. And I've been talking to them so much. We do calls multiple times during the week, and they have been so helpful in supporting each other and helping to figure out ways to break down barriers and walls and roadblocks. And also we spend a lot of our time dealing with the frustrations of all of that. So we'd love to hear from you about what you're experiencing, what you're finding that works well, but especially what are your barriers? And maybe we can help you, and maybe you'll come up with something that can help us, because we really miss our residents, and we know that talking to them on the phone and through the computer is not for everybody. And it doesn't take in it. And some people, I mean, for me, I really personally much rather be in the room with somebody. I'm not as good on the phone. So there's a lot of people like that. You think I have the gift of gab. I really don't. So how do you engage people when they're not phone people? Or if they have some sort of limitation with how they communicate verbally, if they can't. So what do you do about that? And that's a challenge with this pandemic, among other things.
Right.
Yeah.
Stevanne, is everyone supposed to have a phone in their room?
No.
No. Okay.
Isn't that a shame?
Yeah.
So if I ran the world, yes.
Yeah.
But it's not a regulation, so that's the problem.
We need to fix that.
I agree.
Yeah.
I agree with you.
That'll be our legislative proposal.
Yeah. I am, by the way, I'm hoping that the regulations come out for comment for both assisted living and nursing home, and especially around access to telephones and privacy and phone calls, maybe revamping that up a little bit. That's something I would encourage you all to look at. Anything related to social isolation that you think could be be strengthened in the regulation would help, because that's the minimum standard. The regulations are the minimum standards. And if anybody wants to talk regulations with me sometime, I really like doing that. I know that's probably strange. I'm not talking regs, but I do. So anybody wants to have a regulation call looking at things and what's there and what's not there, I think it's worth doing. Some places, by the way, will do the right thing no matter what. Get the resident a phone. There are free cell phone programs if you have Medicaid. But the problem is, what do you do for somebody that can't operate a cell phone? Right. They need an adapt. They need something that makes the communication more accessible. And you all are the experts in that more than I am. Accessible communication. So what do we do for people that need something different? And I reach out to my friends in the disability community all the time and say, I don't know what to do. I don't know what's available. Can you help me? So I will basically reach out to you all about that.
Yeah.
And I have a quick question.
Yes, ma'am.
What? This is Jessica, by the way. So, what do they think is going to happen by them having a phone? Do they think that they're going to be like, hello, can you come and pick me up and get me out of this place? Or do they think some crazy drama? What is their factors, guidelines of them not being able to have a full phone?
All about the dollar bill.
Trying to save pennies.
Yeah, I think there's a lot of issues with that. And also, for some of these buildings, they're old. So they didn't have the infrastructure like for a phone line in all the rooms, and they haven't caught up with the times. And then there are some people, I think what you might be alluding to, there's some people that prefer people not to have a phone. So that's a different issue.
But is that their right to decide for you to say, hey, you can't have a telephone?
The facility's supposed to provide access to a telephone and privacy in conversations. That's what the facility is obligated to do.
This would be a good matter to bring to Disability Law Center. I actually sit on their board, well, the PAMI Council. So this would be a good issue to bring to their attention.
And Jessica, if you want, I can send you or send the group the link to the regulations in nursing homes and assisted living, so you can actually see what the language says.
Yes, please, because some of us don't understand the language, but if we show it to the lawyers at Disability Law Center, they will be on it because they understand language very well.
One of the lawyers pulled at Disability Rights pulled out the specific language for me. So I'm happy to forward that, Jessica, if you want to send me your email in the chat box.
Yeah, and
Sarah.
Randy Ames is online today, and he can maybe help with this as well. So
yeah, and Randy, I've worked with Randy before, and she's sorry. Yeah, that's okay. She's a very knowledgeable advocate about the regulations and can definitely help you. But I'm also happy to tell you from our perspective. So Sarah and Dave and Michael will let me know what my homework is, and I'd be happy to follow up on anything that comes up either through the chat or after this too.
I would be happy to talk to you some more because it seems like we got a bunch of work to do. It seems like it's going to take everybody to make something happen. It's just not a you thingy or individual thingy. It seems like we're all going to have to speak out about the different topics. We have a bunch of work to do for the disability field, for the nursing homes, it's a lot of stuff that we have work to do.
Yeah, I think we can do a lot together. So I'm all about talking about with you all again about anything you want, or individually if people want to reach out to me, just let me know, because I think we are a lot more powerful together than we are alone.
Absolutely. That is advocacy.
That's right. I always need help.
I do want to just say to let people know, if you haven't scrolled through the chat, because it's way past what I can keep up with. So I apologize for that, but there is a wealth of really good information that has gone through the chat, and some good ideas as well, Stevanne, for connecting with people or for helping with voting. Hopefully I didn't miss too many of the questions. I know we're almost at 3 o'clock. There is one question that I did want to ask. Do you work closely with the, I guess it's the Office of Healthcare Quality? And what is the relationship between the Ombudsman program and?
So I tell you, we're very fortunate. My predecessor, Alice, was the state ombudsman prior to me. I've been the state ombudsman for 4.5 years, and I didn't tell you anything about myself. I really apologize. I got so excited at just talking about the program, but I was a local ombudsman for a long time, for 8 years, and I've done social work, and I've worked in a variety of settings. So I apologize. So if anybody wants to know more about my background, I'm happy to tell you. But when Alice was the state ombudsman, she had sort of formalized a lot of relationships with other agencies, including Disability Rights Maryland and Legal Aid and Office of Healthcare Quality and the Attorney General's office and lots of other people, not to mention our counties that we work with very closely, and we love working with the counties where our ombudsmen work. You know, also the SILS is more of a newer relationship, I would say, and I tried really hard to work with all of you, and I want to keep doing that. But Office of Healthcare Quality, we have a long-standing relationship with them, and in part because we always want people to know that that is an option if they would like to make a referral, and we want people to understand what they do. We work closely on different stakeholders groups. We also have talked a lot about sort of different issues that have come up that are important to us, and talking with OHCQ, Office of Healthcare Quality, about how to interpret regulations to make sure we understand. They also teach, we have them teach our new employees about what they do and their role. There's certain requirements that when they're supposed to be in touch with us, like during the surveys process, which is their inspections for nursing homes. And so lots and lots of things. We're very fortunate to have the relationship we have with them. We do a lot of education with people to understand how we're different and what we do that's different. And they are very interested in quality of care and quality of life, but they come at it from a regulatory standpoint, that it's about the minimum standards. Whereas we come at it from, we understand the regulations, but we're about what does the resident want. Right. And so for me, sometimes I wish I was a surveyor, because I could say the facility must do this. And I think sometimes, and I'm not going to speak for them, but I think sometimes they wish that they were ombudsman, because then they could advocate for what the resident wants, not just what the law says. Right. There's been a lot of, they've been really busy lately. A lot of their complaints, they're focusing a lot on infection control and very serious complaints, but they are taking other kinds of complaints. So if anybody does need to reach out to them, I would encourage you to do so, to talk with them about your concerns. They have an online complaint form if you do want to make a complaint. Very nice group of people to work with. But I think they have like the rest of us that are advocates, and just like you all, I think they're very busy right now. Just trying to do what they need to do to help with people with their concerns during this time, but they're coming at it from a different way. So I don't know if that got at what the question, that person asking the question wanted to know, but if you want to talk more about that, let me know.
Okay, so we are beyond 3 o'clock, so we have to wrap up. I want to thank you. I cannot thank you enough, and I do want to say, I think on behalf of all of the SIL directors and everybody else, this has been incredibly valuable information. I would say probably maybe this is part 1 of a multi-part series, and we'll have to make sure that we do this again and continue the conversation. At this point, thank you. I'm going to turn it quickly back over to Sarah. I do want to say again that there is a lot of information in the chat, including apparently ARI is still looking for a housing specialist, and that job description was also placed into the chat. So if you are welcome. If you are in that area and you're not, it doesn't mean you can't work for us, then go ahead and take a look at that. And with that, I will turn it back over to Sarah.
So, yeah, and we did repost Stevanne's contact information at the bottom, because there's this is a very long chat, and so you have to go a long ways back up to get it. So it's been reposted in the bottom, but we want to thank everybody for attending. I want to remind everyone that we have these sessions every Monday at 2 o'clock, and that if you when you registered for today, it puts you on a list to receive information about each of our calls, but you do have to register individually every Monday for each Monday's call so that you can get that session's Zoom link. So also we encourage you to spread the word. You know, these are always listed on all the Facebook pages of the Centers for Independent Living. If you haven't liked any of them, you should. You'd get lots of information about events that are coming up and keeps you in the know. And then we encourage you to share that with other people in the community that might want to know about these Monday sessions. We are encourage you to let us know in advance if you have accessibility needs. We've been getting captioners and have from time to time had, when requested, had interpreters as well. So I'm going to let Mike Bullis take things from here about reminding us all about donations, that we are accepting donations to help us with these Monday calls, and about next week's session.
Sure, thank you very much. I want to thank people for donations. We've told you that it would be because of your invaluable support that we're able to keep this going, and many of you have contributed. I'm not going to out anybody directly except to say Maggie, Carrie, Francis, Mike, Priscilla, Terry, Crosby, Lori, and Delissa, as well as Darlene. I want to thank each and every one of you for your donations, and we're very, very appreciative. We can't do this work without you, and your donations give us the freedom to be able to help people and to change lives of people with disabilities. That's what Centers for Independent Living do. We change lives. So thank you all so much. Speaking of Centers for Independent Living, next week, we're going to enlist your support in an hour of discussion about what Centers for Independent Living ought to be doing. It's a look at the next 3 years of our lives in Maryland. We have a state plan that we develop every 3 years. It's a rather lengthy state plan with a lot of federal gobbledygook in it and state gobbledygook, which I will not volunteer to read for you or to involve you with. But there are some goals, and there are some action steps and things that we've listed, and we might and we want to get your input about things that you think your SIL ought to be doing, or SILs in general ought to be doing. So please come and join us. We promise it won't be boring, and well, I guess we can't promise it won't be boring. No, it won't be boring, otherwise I'll quit. It'll be fun. It'll be a great opportunity for you to join with us as we sort of think about what these next 3 years ought to be for Centers for Independent Living in the state of Maryland. As the hub for independent living and services for people with disabilities, we want to make sure we're doing what you think is important. So thank you all very much for attending today. This is Steveanne. Thank you very much again. She was phenomenal. She's one of my favorite people in Maryland, who really does say things clearly and concisely, and doesn't hedge bets and tell you, oh, I'm sorry, I'm the bureaucrat, I can't answer that question. She does a wonderful, phenomenal job. So thank you all very much for being here this week. Again, after you get through today, if you have an opportunity, any amount you can give us to help the cost for these meetings is most appreciated. Thank you very much. People with disabilities are grateful, and I think we're done. Sarah, did you have anything else? No? All right.
Nothing else. Thank you.
All right. Thank you, everybody.
Thank you.
Take care now. See you next week. It's a wrap.
Bye, everybody.
Bye now.